And how are congenital heart defects diagnosed? A lot of them are diagnosed in utero before the child's born. So the medical staff at the hospital where the child is going to be delivered is going to know that this child may need to be born at a specific hospital, or she may be transferred to a hospital that is better equipped to deal with children who have congenital heart defects. There actually are pediatric cardiologists who specialize in congenital heart defects. Back when I first got out of my 2-year program, I had worked in such a unit at the Children's Hospital in Buffalo. So, at the time, this was an emerging technology, but if you know anybody who's had a child and who's been pregnant and they've showed you the ultrasounds, you can see some very clear photos of, what the baby looks like. So they can scan the internal organs and scan the heart. And so if the technician sees anything that looks suspicious, they can call in the pediatric cardiologist for a consultation during those ultrasounds. So they have an idea of what the child could be facing at birth. So most times these are diagnosed in utero, but it is sometimes that something could be missed. And if the child is born and how she presents at birth, cyanosis, bluing, especially when they cry. So you'll notice them turning blue, and for babies with darker skin, you'll see that their lips are blue or their nail beds are blue. So the doctor also can determine heart murmurs, extra sounds that the doctor hears on his or her physical examination. Some of the doctors I work with said, my ears, the training of my ears can tell me, and the other tests can confirm it, but, their ears were always one of their best diagnostic instruments. Sometimes kids have heart murmurs and they're nothing. They call them innocent, functional murmurs, especially in kids that are very thin. They will hear lots of extra sounds of just the blood flowing through the heart. But sometimes a heart murmur can mean that there are some congenital heart problems. So children who present at birth, they've got cyanosis, maybe some murmurs that the cardiologist wants to get further explored. They will do electrocardiograms. So they will do electrocardiograms, yes, on newborns, echocardiograms, ultrasounds of the heart, x-rays, and then they usually go to the heart catheterization lab to get images, inject dye, and so that they can get an idea of what the child's defect is. Back when I worked at the Children's Hospital, there were some kids who were sent in during their infancy, childhood, sports physicals, school nurses. So, sometimes these things are missed at birth, and, the children maybe are having some issues. The school nurse hears a heart murmur and thinks, oh, I need to really, get this referred to the pediatric cardiologist, or the kids are not growing because they have poor circulation and their heart is not working optimally. So oftentimes kids with poor growth and heart murmurs are going to be referred to the pediatric cardiologist. So let's look at some common defects here. A ventricular septal defect, or VSD. This is one of the most common defects that you're going to see. It's a hole between the two ventricles. Again, the two main pumping chambers of the heart. It can be small or it can be quite large. Small VSDs often close on their own, and there's nothing that needs to be done. There'll never be any surgery. The child's normal, has no activity restrictions. Large VSDs may need some surgery to be repaired, because you can see in the diagram that there is a mixing of both oxygenated and deoxygenated blood. So, depending on how large the VSD is. The atrial septal defect, or an ASD, it's just what it sounds like. It's a hole between the upper chambers of the heart, the hole between the atria. So oftentimes this is common in kids that are preemies. So the patent foramen ovale, if you look at the top of the atria, it doesn't close. So larger need surgery. Oftentimes they're less likely to close on their own than ventricular septal defect, and the kids are going to need surgery. Once again, you see that there is this mixing of oxygenated and deoxygenated blood. So that, that's where part kids may have cyanosis.